everyone, this is Congresswoman Katie Porter. I represent California's 45th Congressional District in Orange County, California. And what I wanted to do today is talk to you about the American Rescue Plan. And the first thing I want to say about this is a rescue. What this bill fundamentally is disaster relief. Because the COVID-19 pandemic has been an economic and a health disaster. So we called it the American Rescue Plan because our economy, our health, our schools, so many areas of our country need help. So this is a disaster relief bill, and that's how we're going to be thinking about what it does. What are the problems it's trying to solve? I'm going to walk you through what it does, sometimes what it doesn't do, and then be able to take some of your questions. So thank you everyone for tuning in. Again, I'm Representative Katie Porter, breaking down for you the big bill that was passed today by the House of Representatives, the American Rescue Plan. So the first question you might have heard about this bill is, it's big. How big? It's big, it's big, it's 1 trillion, it's 1.9 trillion. How big is too big? The bill totals about $1.9 trillion in spending. Why is the bill so big? Because the problem that we're dealing with in our country is really big. We're dealing with very high unemployment, particularly among women of color and in certain industries. Our schools in many areas are closed. Food banks, hunger, record highs, and of course people are still getting sick because of COVID-19. So yes, the bill is big, but you know that phrase, a day late and a dollar short? Congress was definitely a day late in passing this bill. We were many days late. It took us months and months. We had to elect a new president to even pass this bill to help the American people. So we might be a day late, but we didn't go a dollar short. We tried to make the bill meet the size of the problem. So what's in it? Where does this money go, and how is it going to help our economy and our society? So I want to start with this, the survival checks. And this has been probably one of the most talked about parts of this bill. These survival checks are the payments that you've been hearing about, that you're going to be getting automatically. Now the amount of those survival checks is going to be $1,400 in most instances. And if you recall, Congress previously passed a $600 payment, so you're going to get $1,400, and this applies to about 85% of households in the United States. So we're talking about a big amount of families getting help. That's important because a huge number of families have been hurt by COVID-19. Even those who maybe haven't lost their income have seen increased expenses, more expenses for childcare, more expenses for commuting because of no public transportation, things like that. So those $1,400 payments will go, again, to 85% of American families, and there is a cutoff. When your income gets above a certain level, you don't get the payment. So where's the cutoff? If you're single, the cutoff at which you'll receive no payment is $80,000. If you're like me, a single parent, or you file as head of household, the cutoff is going to be $120,000. And if you're married and you file jointly, the cutoff is going to be $160,000. All right? Now, one of the things that I criticized about with this bill is that, I think that different families, this doesn't necessarily line up. There are families who are heads of household who are in real trouble. There are families who are married who both kept their jobs. But this is the basic threshold. So if your income is below this, you're going to get the survival check. Do you have to apply? No. They're going to automatically send you this money. And it's going to be based on your last filed taxes. So if you filed in 2020 for your 2020 taxes already, you'll get it based on that. If you filed for 2019, you'll get it based on that. If your income's changed, they'll send you a plus up down the road. So you should be watching for these payments. President Biden has made clear he knows that there are families who are not able to make their rent, are not able to put their food on the table, and they want to get this money out as fast as they can. All right, so watch for these checks. If you're below this income, you should be getting a check, hopefully in the next 3 to 4 weeks. So be on the lookout and make sure you watch for it. All right, so that is the survival checks. All right, now the next thing I want to talk about is probably my personal favorite part of the bill, which is the child tax credit. Now, the child tax credit, I gotta admit, anything that has tax credit in the title doesn't sound super exciting, but trust me on this. The child tax credit is amazing, because what we're gonna do with this one part of the American Rescue Plan is cut child poverty in half. Let me say that again. We're gonna cut child poverty in half. And we have very high rates of child poverty in the United States compared to other countries. This is an investment not just in people who have kids, but this is an investment in our future workforce, in the workforce that's going to be getting us American jobs and creating things for our future. So how's this going to work? Families that have children will receive a $3,000 child tax credit for their children per child. Okay, if your children are 6 to 17 years old, all right? This does not look very good, hang on. All right, and then if you have a little child, a younger child, you're gonna get $3,600 per, we're gonna call these babies to 5, okay, up through age 6. They're gonna get $3,600. And this is a big increase in the child tax credit. It's going to be based again on your last filed taxes, either 2019 or 2020. And this is really a big deal. And so we're going to cut child poverty in half. For so many of you, I have heard over and over again, you're struggling with the costs of childcare. The cost of putting a child in daycare for a young child can be $12,000 or even more. In some states, it's more than in-state college tuition. That was my situation. My daughter Betsy's preschool cost more than her college tuition would have at the same time if she'd been at the University of California. So you're going to be getting these benefits. Now, one thing I want to point out here is something that I like to call the single parent penalty. And this is something that I am continuing to work on. I'm not going to give up. But the way these the child tax credit is structured. Remember here how we saw single people can make up to 80. Married people can make double that. Heads of household, those single parents halfway in between. It's the same structure for the child tax credit. The numbers are a little bit different. We're looking at let me put this down here. We're looking at $75,000 for single. All right. We're looking at $112,500 for those heads of households, and we're looking for here it'll be $150,000 for married. So what the issue I have here with this cutoff is that this is a child tax credit. It's about the cost of having a child. And no child should get less of a benefit just because the marital status of their parents is different. So if you're a child living in a single parent family, you are less likely to get the tax credit and you will get a smaller amount in some cases than children who are living in families with 2 parents, a married couple. And so this I call the single parent penalty, but to be clear, who's really being punished here is children in single parent households. And those children, all the research tells us, need the most help. Trust me, there is no discount for being a single parent. I say that to you as the last Congress, the only single parent of young children serving in the Congress. If you know of any chain stores anything that gives a discount to single parents, text me, because I want to start shopping there. So the problem with this is it's not going to give equal child tax credit to children in single family households, but you still will qualify if you're below these income limits. And so certainly for children near the poverty line, this is going to make a huge, huge difference. All right, that is our child tax credit. Okay, I'm going to move over to the other side here so I can tell you about the next part, which is unemployment. The reality is the pandemic has caused really, really high unemployment. Unemployment rates that this country hasn't seen since the Great Depression. And what we have done here in the American Rescue Plan is provide a continued increase in the unemployment benefit that people get. Now remember, unemployment is something that we all pay into when we're employed. It's called unemployment insurance for a reason. It's not a giveaway. We all pay into this system so that when we become unemployed, it will be there for us. But in many cases, that unemployment amount is not enough to allow people to keep a roof over their head and food on the table. So what we've done in the American Rescue Plan is to add $300 per week to the unemployment benefit, and that is going to continue until September 6th. All right, so throughout the summer, as we're continuing to fight the pandemic, to get people vaccinated, those who are still unemployed are going to see this additional $300, and that's going to go till September 6th. Meanwhile, we want people to get back to work. We want to get our economy open, because until we want to get the virus under control. If we don't get the virus under control, our economy can't fully open. So how are we going to do that? All right. This first part, by the way, you can think about as money in the pocket. And I don't even like to think about it as money in pockets, because I think people need to spend this money to live and to make ends meet. But this is sort of the money in the pocket part. Now I want to talk with you about shots in arms. What are we doing to actually give people the shots and the care that they need? So the American Rescue Plan, when we think about these shots in arms, right, and vaccines, what is it doing? It allows $20 billion for vaccination, for vaccine programs. So many of you are waiting and waiting and waiting to get vaccines. This $20 billion is going to make that more possible. For those of you who are just joining, just to remind you, I'm Representative Katie Porter. I represent Orange County, California, the 45th Congressional District, and I'm using this big whiteboard to break down for you what's in the bill that passed the House of Representatives today that will be signed by President Biden. It's called the American Rescue Plan. But what's in it? What is the plan? Americans deserve to know. So I'm going through what's in it: survival checks, child tax credit, increase in unemployment, and now we're talking about the health benefits, the shots in arms. So you're going to get $20 billion toward vaccines. Just because we're vaccinating, in the meantime, we have to keep testing, and we have to keep tracing. We have to keep doing things to help. And so testing and tracing here, $51 billion. And so this is really part of how we're going to get our economy open and not need so much financial assistance as if we fight the virus. All right? Now, we said money into people's wallets, shots into people's arms. This is my favorite part of the plan as a mom of 3. Kids in school. Got to get that happening really, really soon. Kids in school. So what's going on there? What the bill does is provide $130 billion to state departments of education. And what they're going to do is, in turn, give this money out to school districts. They're going to provide extra resources. And the goal here is not to open schools. It's to open schools safely. And that means having money for modifications that might need to be made, to classrooms for additional ventilation, to make sure we can space kids out more, for personal protective equipment if needed, and we're going to be able to get those kids in school. Now, if you have younger children who are not in school, you're worried about the cost of childcare. I've had a roundtable here in Orange County, California, talking with childcare providers. They're closing, they're struggling, the number of students they have is going down. It's estimated that a lot of these childcare centers are going to close for good. So we don't want that. We already have a shortage of affordable quality childcare in this country. So what the bill does for younger kids, all right, so that's what it does for older kids. For younger kids, it provides $39 billion for child development block grants, and then additional money as well into the Child Care Stabilization Fund. So, again, I'm Representative Katie Porter. I represent Orange County, California, the 45th Congressional District. This is my biggest whiteboard, and I'm using it today to talk about the American Rescue Plan. The bill that was passed the House of Representatives today, what's in it and how is it going to help address both the virus and our economic problems. So we've gone over getting money to people who need it, unemployment, help to households, help to those with children, money to people who need it. We've talked about vaccines, shots in arms, testing, tracing, public health. Now we're talking about kids. And this is both kids in school and childcare. I should also add, there's a chunk of money there, around $40 billion, similar to the childcare amount, to go to higher education. Now, most of that money is targeted for emergency financial aid. A lot of our students, because of the high cost of college, they're working to help pay for their tuition. A lot of them worked in restaurants and in bars as servers, and a lot of those jobs are gone. So emergency financial aid to help keep kids in college so they can finish their degree. All right, these are the major building blocks of the plan. Let me grab my notes and see if there's anything else I want to tell you about. Oh, yes, this is really, really important. What would have happened, what's going to happen when we do this? What's our goal? So obviously it's to fight the pandemic, it's to get kids back in school, it's to recover our economy. What does that really look like? With the American Rescue Plan, what economists say is that we can return to full employment in about 1 year. 1 year, now that's still a long time. That's why we provide this increase in unemployment through the fall. That's why we're providing these survival checks. But in about 1 year, with this investment, we should be able to get people back to work at the same level. If we didn't take this action, it would take more than 3 years to return employment to the pre-levels. So this is an expensive plan. It's money that we're making, investing into families, into children, into schools, into public health. But the cost of doing nothing here would be to leave our economy in a devastating situation for more than 3 years. We can't afford that. Families are going hungry, kids are struggling, but we also can't afford to fall behind every country in the world who has been able to get this virus under control and begin their economy back up. So I want to encourage you to ask questions. If you have any questions, please type them in. I'll do my best to answer them. I even got the entire bill pulled up, so I can try to look up and answer your questions. But this is certainly not everything that's in the bill. But if you think about the big building blocks, where is most of the money going? It's going to these things. Money for families, shots in arms, vaccine, testing, tracing, helping kids get back in school, childcare, and college. And the effect of all of these things together is to be able to return people to jobs. And that last point, people in jobs, there's an additional part of this bill that is targeted particularly to our service industry, to restaurants. There's a particular program to help assist restaurants in being able to stay in business even as they've had to close for a while, and that'll help keep those restaurants open and keep those restaurant jobs alive. So that's a big chunk of what we're going to be doing. There also is some money in the program, in addition to restaurants, there's some money in the program, $15 billion for economic injury disaster loans. This is a small business program. This was part of the CARES Act. It was part of the second package that we passed, and now it's part of the American Rescue Plan. So if you are a small business, please reach out to your local small business development center. We have one here in Orange County in Irvine, and these are free services of the Small Business Administration to help you navigate, figure out if you're eligible for one of these economic injury disaster loans, figure out if you can apply for a paycheck protection, PPP loan, how to find a lender, how to go through the process. So if you're a small business that needs help and didn't get any, or you need help and you need a little bit more, reach out to your Small Business Development Center. You don't need to pay anyone to help you get help. Your local Small Business Development Center is there for you. Somebody asked a question about vaccines, and they said, are vaccines free? Yes, vaccines are free, period, full stop. You may be asked to provide your insurance card if you have insurance, but nobody should be denied a vaccine because of inability to pay. You shouldn't pay a site fee, a visit fee, a doctor's fee, an equipment fee. We all know that healthcare sometimes comes with a lot of these fees. The vaccine and the process of getting that shot in your arm is free for every single American. And I want to encourage people to get their vaccines when they're able to. And on that note, I want to remind people that with vaccines, we're going to more than double in the month of March the number of vaccinations that we had put together in December, January, and February. So I know you've been waiting and waiting, refreshing apps, signing up, trying to get onto pharmacy websites, calling your public health department. But know that we've already vaccinated at least one dose 20% of Americans. And we're gonna more than double that number in the next month. So that's gonna be a huge, huge increase. So please keep wearing your mask. Please stay home if you can. Please go outside, stay safe, limit indoor gatherings, because the next 4 to 6 weeks will see most Americans be able to get vaccinated. By the 4th of July, here in Orange County, our county public health department says by the 4th of July, they hope to have been able to vaccinate everybody, even children, as they're waiting for that testing result. So hang in there. Somebody asked, I wanted to talk about this other big important pillar, and I can't believe I forgot this part because it's really, really important. See, my marker there is not bold enough for how important this is. State and local funding. All right, the bill has a big chunk of money in it for state and local funding. The overall United States amount is about $350 billion. Some of that will go to departments of education. California, where I'm standing today here, California is estimated to get about $43 billion. Why is this important? Why are we giving money to state and local governments? Because if we don't, state and local governments will have to have dramatic layoffs of public employees. They're going to make dramatic cuts to the very programs that people need right now. Programs like public health departments, programs like childcare, programs like Meals on Wheels, first responders, law enforcement. We don't want to worsen the unemployment that we already have by seeing state and local government lay people off. And so money is going to go to each state. Larger cities will get their own amount of money, and the state will dole out money to smaller cities. We did this once before. It was very, very effective. And I will tell you, here in Orange County, I represent the 45th Congressional District, and most of my mayors, most of my city council members, most of my county commissioners are Republicans. I'm a Democrat. And let me tell you, across the board, what I've heard is that our cities need this money, our counties need this money, and our state needs this money. They don't have the ability to deficit spend, and so we need to be there as the federal government to backstop them. And so that's a really, really important part. So to repeat, California estimated to get about $43 billion. Every state is going to get money. Larger cities will get money, and then smaller cities will also get resources. And what's that going to do? It's going to help keep people in jobs. It's going to help keep our schools open, get them open if they're not open, and it's going to help provide critical social services to people. All right, let's see what other questions we have. Somebody asked about vaccine again. We talked about the vaccine being free, and somebody said, well, some of these things that you've got up here depend on your income. You get a different benefit depending on your income. Is there an income effect? Can I not get the vaccine? Do I have to pay for the vaccine if my income's too high? No. Every single American is eligible to get a free vaccine. So please watch out for any scams. Do not pay for your vaccine. Everybody's eligible to get a free vaccine regardless of your income. And the vaccine is safe. It's effective. We have several more months of people who've gotten the shots, they're not getting sick, and most importantly, the vaccine will protect you from being hospitalized and from dying of COVID-19. Period. All three vaccines that are approved right now, we have Moderna, Pfizer, and Johnson & Johnson. Take whichever one you can get, because all three of them are going to dramatically lower, almost eliminate your risk of dying or being hospitalized from COVID. So please, I know a lot of you want the vaccine and are trying hard to get it. Keep patient, because the next couple weeks, March, April, we are going to see a lot more vaccine become available to younger people, people with disabilities. We're already vaccinating teachers in a lot of places, so hang tight. But no charge for the vaccine regardless of your income. Okay, next question I have is about Affordable Care Act subsidies. When people lose their job in this country, they often lose their health insurance. And so this additional amount of unemployment, it helps, but it's not enough to cover the really prohibitive costs sometimes of getting health care. So what we did in the American Rescue Plan is we added funding so that everybody can get at least a silver plan. Remember, there's bronze, silver, and gold on the Affordable Care Act. I get my health care as a Congress member on the Affordable Care Act. And so everybody can get a silver plan without having to pay. The most you'll have to pay is 8.5% of your income. So we're basically subsidizing that cost to make sure people stay insured, even though they might be unemployed, because we really want everyone to be going to the doctor, taking care of themselves, not being afraid to go get a test because of a lack of insurance. Another question we got was about the child tax credit. When will it start and how will you get the money? It's going to start July 1st of 2021. One important thing about this child tax credit is that it's going to be refundable. So even if you weren't paying any taxes, say because you're unemployed, you can still get that child tax credit. And that's a really important point. Oh, the other thing I wanted to add here about unemployment, I'm going to erase this because this is an important point. I said 300 additional a week until September 6th. Another really important thing is $10,200 of unemployment will go untaxed. So that is really increasing the amount of that unemployment that you get to keep. It's a recognition that it's really hard to make ends meet on unemployment. And so we're going to add that amount in. Let me see if there are any additional questions. Anything else? Last questions? Again, American Rescue Plan, money for people. The child tax credit, someone has asked a question about how long will the child tax credit last. So that's going to be a couple years, and then we have a proposal though to make it permanent. So this is a short-term increase in the amount of the child tax credit, from $2,000 up to either $3,000 or $3,600. It's not permanent, but Congress has legislation to make it permanent. One of the exciting things about the child tax credit, I mentioned earlier, the proposition of halving child poverty, cutting it in half. The other exciting thing about the child tax credit is it had strong bipartisan support. Both Republicans and Democrats, even with all the division in Washington, can see that the child tax credit is a smart investment in the next generation and lifting children out of poverty, helping parents address the costs of childcare, of feeding. I have 2 teenagers and a very hungry 9-year-old. I go through a lot of Cinnamon Toast Crunch in a month at my house. So the idea here is to really make it easier for people to make sure that their kids have adequate housing, nutritious food, and quality childcare. So this is temporary, but then we have a bill to make it become permanent. Based on how many Republicans supported this part of the American Rescue Plan, I think we're going to be able to do that. Last couple of questions. We talked a lot about food, about money and what you're going to do in the pocket, about being healthy. I want to talk a little bit about keeping a roof over your head and keeping food on the table, because I know that's been hard, even the essentials during this time. The bill provides for $27.5 billion in emergency rental assistance. A lot of this will be administered through your local cities. So make sure that you're paying attention to any mailers you get. You can apply for these. And then in terms of food, we're adding about $1.1 billion to SNAP, which is, what is SNAP? Supplemental Nutrition Assistance. This is extra food for people to buy. And we're also adding $740 million for food for seniors. Meals on Wheels, seniors who are unable to leave the home because of COVID, because of disabilities. It's really, really important that we want to make sure that everybody has enough to eat in this country. And I have been in Orange County to the food banks. I know it's a crisis for a lot of people. And so continuing to have that bigger benefit for Meals on Wheels, additional funding, because they have seen more and more seniors ask for that nutrition help, and bigger benefits for SNAP, for the Supplemental Nutrition Program. So that is kind of a summary. Thank you so much for tuning in. Please ask questions. If you have questions, reach out to your local congressperson. They should be providing you with more information about what's in this plan. Complete your taxes. Make sure the IRS has your information on file, your current address, so that you can get your survival check. And thank you so much for joining me, Katie Porter, to talk about the American Rescue Plan. Thanks, everyone.